Hey everyone, thanks for joining us today for the new user refresher training. My name's Leah. I'm a trainer here at Modio, and I also have Brandon Holmes and Sue Barton on the call with me. They're also trainers here. It's right about noon. I'll give till like 12:01 or so because I still see people are logging on, joining us. All your microphones are muted, but feel free to put questions in the Q&A option at the bottom, and we'll go through them all at the end. All right, I'll go ahead and get started. So for our new user refresher training today, we're going to go over a few topics. Some of you who have attended the 101 sessions might be familiar with them, but it's a good refresher. The first thing we're going to talk about is the general layout, our navigation toolbar and our team toolbar. Then we'll move on to our alerts and reporting feature. We'll talk about adding a new provider in a two-step process. From there, we'll cover the provider columns, tags, compliance, and the action items column. We'll go over an overview of the different sections within a provider's credentialing profile. We'll chat about the importance of your data in your provider profiles. And then at the end, we'll do a quick QA. So during the presentation, if you have questions, feel free to put them in the chat and we'll get them answered at the end. So I'll switch over to OneView and we'll start our demo here. Sorry, can you all see my screen?
Hey, Leah, yeah, we can.
Okay, perfect. Thank you. So I want to start by talking about our coordinator toolbar on the upper right-hand side. This is our login indicator. You can see my name here. I'm logged in as a OneView trainer. When you all log in, you'll see your name displayed. And you all either have full access coordinator access or read-only coordinator access. Full access just means that you'll have access to everything within the platform, all the data and everything. If you have read-only access, you'll be able to view the data, but not make any edits or changes. And one thing to note with your coordinator access is that one email equals one profile. So you can't repeat those emails when you're creating new coordinator access or new coordinator accounts. Our next two tabs are the support tab and the Modio U tab. These are both really excellent resources for you guys as newer users and always, even if you're not a newer user. I'll click the support tab first to look in there. In the support tab on the right-hand side, we have our hours of operation and phone number, but we also have this email address here. This is probably the best way to reach out to our support team if you need help. It's support@modiohealth.com. Just shoot us an email and somebody will get back to you quickly. The next thing down here that I want to note is our browser capability or compatibility. We highly recommend that you either use Chrome, Safari, or Firefox when you're using our system. If you start to get into Internet Explorer or Microsoft Edge, it tends to get a little glitchy, maybe run a little bit slower, but Chrome, Safari, or Firefox for best usage. And then the next piece down here are our tip guides. There is a tip guide on pretty much every feature within OneView. So if you're ever working on the system and you feel like you need a little additional training or a little help, you can always come down to these tip guides, find the feature that you're looking for, and open up the corresponding tip guide. The tip guides are full of screenshots, documentation, lots of explanations, and some of them even have short videos that you can watch in there. So our next tab is the Modio U tab. And in here, we have some pre-recorded courses. They're a little bit on the longer side. They're like 40 to 45 minutes, but you can really take advantage of like doing a deep dive on any of our features here. So for example, if you're working on onboarding and you really want to learn a lot more about it, just come down here and watch the pre-recorded courses. And also we have our register for courses here. You probably use this one to sign up for our course today, but if you click here, we're always adding new courses. And you can always come in and sign up for additional courses that are going to be happening next month and so on. The next tab over is new features. This is updated roughly every couple of weeks. And it's just a little summary of all the updates or improvements that have been made to the system over the last few weeks. Settings is where you can go to change your password. And then sign out is where you can sign out whenever you're finished working for the day. The next piece of our presentation today, I want to cover the Teams tab. When you log in, this is what your screen is going to look like. You'll be on this Teams tab here. I will do a quick verbal introduction to these ones here, to the other tabs, but just a quick verbal introduction. If you wanted to learn more, you can always come to the ModioU tab or the support tab to learn more about those ones. So the Forms tab is where you'll be able to house any of your forms or applications that have been mapped. And mapping a form is just a way that the system pulls data from a provider's profile and has it pre-populated onto that form. The forms are also integrated with DocuSign, and that way your provider signatures can be acquired electronically. Tracking tab. Tracking is a workflow management tool for you and your team to track all of your steps and progresses while credentialing. And this tab is fully customizable to match your own workflows. Logins is where you can store all of your usernames and passwords for any accounts that you manage for both yourselves and for your providers. Tasks is a pretty simple tool. Most folks that use Tasks use it as an electronic sticky note, as a place to leave a quick reminder note for themselves. And then finally, we have the Notes tab. The Notes tab will house any notes that you add to your provider profiles. So as we move further into our training today, I'm going to show you a few different places where you can add notes to your provider profiles. And so from there, you'd be able to sort, filter, find, and even edit the notes that you're looking for. But from there, I'll turn our attention back to the Teams tab. So when you log into OneView, your page is going to look similar to this. You'll see your own logo here and your team name displayed here. And then everything underneath it is going to reflect your team. So it'll be your provider roster, your alerts, and all your tags and so on. The first button here, the Alerts tab, I want to cover. So what an alert is in our system is it's a system scanning for an expiration date that's set to expire in 60 days or less. I'm just going to click on the button to kind of show you what our system is looking for alerts. So the system is scanning for expiration dates for your state licenses, DEA licenses, state-controlled substance licenses, ABMS certs, OIG, CAQH, other expirable certifications, expirable documents, and finally malpractice insurance. But one cool thing about this alert section is that it has something called primary source integration set here, and that's indicated by this little updater button, kind of looks like a refresh button. And you can use this updater to communicate with the state license database and see if your provider has already updated their license or not. And I also wanted to highlight this expiration column here. So anything in the yellow means the expiration date's coming up. Anything that turns that red color means that it's already expired. We can use this updater to see if our providers have already updated their licenses. I'm just going to click this little updater button here. And on the left-hand side, it displays everything that's already existing in Modio. And on the right, it indicates anything new that's been updated in that state license database. So here, we've got a new expiration date, and it's indicated by that yellow color. It's highlighted in yellow. Notice the old one expired last month in 2022, and this new one, it expires about 2 years from now. What I can do with this is at the bottom, I can click Upload Primary Source Document, and I can hit Accept Changes, and this new information will pull over. The primary source document from the state license website will pull into the provider's profile, and then my alert is going to fall off the list here. And I'll show you what this document looks like too, just in case you want to see. That's that state license document. And if I did hit that accept changes, that document would fall into this provider, Dr. Michael Quinn's profile, and I'll show you documents in just a few minutes. For this example, I'm just going to hit the X because I'm in a training environment, but in real life, you would just hit accept changes. If I ran this updater and I got a response from the state license database that my provider had not updated their license yet, meaning it's still in like an expired status, there is an email feature built in on any of these sections where you would see an alert. And you can use this email feature to reach out to your provider and let them know that their state license or any of these licenses might need some attention. So I'm just going to click this little email icon and you get this pop-up. It automatically generates my name here, and that's because it's connected to my login here. I'm the one that's logged in, so the email is generating from me. And if I click in this space here, I get a drop down of all the coordinators on my team, as well as all the providers down here that have a state license coming up expired. So I could select one from the list. I could select more than one. I can also use this provider button here if I wanted to send one email to everyone on that list who has an expiration date, excuse me, a state license expiration date coming up. From there, I can free text into the email message field. I could write something like, hey, provider, your state license is expiring, please renew. From there, you can hit send, and your provider will receive that email message to the email address displayed behind their name. I can also use it to communicate with my coordinators. If I didn't want to send an email directly to my providers, I could send it to the other coordinators on my team to let them know. So whatever your workflow is, you can use that. So that's our alert section. I'm going to go back to the Teams tab here to get back to that home screen. And right next to the alert section, there's a little drop-down arrow or a caret. If I click that, that's how I can access all of my reports. The top 4 web reports, if I run those, it'll just open up as like a large chart on your screen and you can filter by column. But these bottom ones here, the CSV reports, those will generate a report on a large Excel spreadsheet. And the key takeaway on these reports for our 101 new user refresher training is that the data in these reports is pulling directly from the data that's housed within your provider profiles. So the more data that's in those profiles, the more robust these reports are going to be. If you come across a reporting need that you don't see displayed here, you can reach out to us and we could work with you to try to set up a custom report as well. So that's reports and alerts. The next piece I want to cover is adding a new provider. So I know right now your teams probably have quite a few providers on your rosters, but at some point you might be adding a new provider to your list. Adding a new provider is a 2-step process. And first step is clicking this add provider button on the upper right, and you'll get this pop-up. There are 4 required fields that you need to fill in: provider name, title, specialty list, and provider email. They're all indicated by that red star. And there's an example I like to use. I'm going to use a provider. He works here at Modio. He's actually one of our founders. His name is Dr. Kirk Heath. So I'm just going to type his name in. Oops, I spelled it. Just one sec. You can type it in first name, last name, or last name, first name. It doesn't matter. But when I type in his name, I get this drop down of potential matches. And what this is doing is it's pulling potential matches from a really large static database of providers that we have basic credentialing information on. I like to use Dr. Kirk Heath as an example here, because if you look, it generated matches for 2 Dr. Heather Kirks, both family med providers. But if you look closely, their MPI are different, indicating that they're not the same provider. So before you select someone from the list, just make sure you're checking either like an MPI number or license number to make sure you're selecting the correct provider. If you don't see your provider listed, there's an option at the bottom here that says don't see provider listed. Click here to skip profile claim. You can use that, and then you would just be entering the data manually. I'll select this Dr. Kirk Heath because I know that's his MPI. And then I still need to fill in my other 3 fields. So first one is title. I know he's an MD, so I'll click there. Specialty list. There's a really long list here, so you can use completion matching. I know he's a general surgeon. And then email. Best practice, if you have your provider's email, you want to enter it now. But if you don't have their email, like maybe they're a new hire and HR hasn't generated their work email yet, you can use a temporary placeholder. And the placeholder that we want you to use is first name dot last name at modio.email. So in this case, if I didn't know Dr. Kirk Heath's email, I would just type in first name dot last name at modio.email. And then the next step would be to hit save. For this example, I'm going to hit cancel because he's already lives on our provider roster here. But in real life, you would hit save, and that would be step 1. your team would do a quick refresh. And then from there, you can search for your newly added provider by using this provider search bar here. You can search by first name or last name. Oops. And you can pull up the new provider. And step 2 is to hover over either their photo or their initials and see where it says profile. I'm going to click there. And this is what we call the profile card. On this, the next step would be to use this little updater icon again. It's the same icon that we saw over in the alert section. And from here, you can search for existing basic credentialing data that we have on our providers. So I'm just going to click this one here. And on the left-hand side is everything that's currently in Dr. Karki's profile. And on the right is everything that came through the MPI search here. So I could add any additional data by using these check marks. I can also grab that MPI verification document by clicking there and then hitting accept changes. One other kind of fun thing that you can do from this profile card is you can add those photos. So if I hover over the picture here, it has changed. And if I have a photo of my provider in my device, whatever device I'm on, you can add it there. There's also a way that you can run a really quick CV with the existing information in your provider's profile from here. On the upper right, it looks kind of like a Word document with a W here. I can run that. I'll click here. You get a pop-up with check marks. So you can customize that CV, include or not include any information that you want, and then hit save. And from here, I think it's on my other monitor. Here, I'll share it, sorry. So there you've got your CV. Okay. So moving forward, that's adding a new provider. The next piece I kind of want to cover is adding tags. Tags is a way to create a sublist within your provider roster. And so at some point, you might not want to look at like all the providers on your list, especially as you have quite a few. You don't want to be scrolling through and trying to find them. So you can use a tag to create a sublist. Right now in this training environment, there are a few tags that already exist in our provider roster. And if I use this drop-down arrow, I can sort by any of those. But if I wanted to add a new tag, I would come over to our action items column and just click the edit button. The edit button is it looks like a pencil on paper, and you'll see that in a lot of different places throughout the platform. So I'm just going to click this edit button. And the very top row here is tags. If I click in there, I do get a drop down of all the current tags or all of the tags that currently live within my team. I could select one if I wanted to add a tag, but I can also create custom tags just by free texting and then hitting tab. So one really popular use case for tags is by location. So if I wanted to add a certain location to this provider, I'll just say Colorado. If this provider resides in Colorado, I could type in Colorado and then hit tab. And now I've created that Colorado tag. Now I'll hit save. And now you can see I added dermatology, which was an existing one, and then I added that Colorado tag as well. And if I wanted to go down to the next one, edit button, I've already got a tag here. I could go ahead and add that Colorado tag if I wanted to and hit save. And now when I use this drop down to filter, I'm going to hit Colorado. And it's going to do a quick refresh. And it's going to narrow it down to just the providers who have that Colorado tag. If I wanted to, I can also remove a tag. I'm just going to use this little X. There's a tiny gray X. Hopefully you can see it. But I'm just clicking that gray X and hitting save. And now those tags are gone. And I'm going to remove the Colorado tag from this one as well. So you can get pretty creative with tags. You can really search any way you want, see whichever providers you want. You could add more than one tag per profile. Really a lot of options there with the tags. The next column here is the compliance column. This is directly related to our alerts button. So here in alerts, it says there are 37 alerts. But if I come down to the compliance column, it's organized by at a provider level. So I know this one provider has 5 alerts, this one has 2. So sometimes you might want to view those alerts per provider rather than looking at all 37 at the same time. So you can definitely do that from the compliance column. And then moving over, we've got our action items column. The envelope icon here is directly related to our onboarding feature. Some of you may be using it, some of you may not. But what the onboarding feature is a way that you can send a welcome message to your providers, and then your providers would create a login and they would be prompted to fill in some of the data in their own profiles themselves. And this little email icon will change according to what step in the onboarding process your providers are in. Next one we have, it looks like a little doctor. That's just a way to get into a credentialing profile. It's the same thing as clicking on your provider's name over here, but you'll see this little icon in a couple other places throughout the platform. The edit button, I know we talked about it briefly with tags. I'll just click there one more time. We've got tags up top, but at the bottom we have a note section. We have both a public note and a team note. If you add a team note, all of your full access coordinators will be able to view all of those team notes. If you add a public note, your full access coordinators can see it. Your read-only coordinators, if you have any read-only coordinators, they can view that. And if you gave your providers access through that onboarding feature, they can see their own public notes. So that's the note section. We have the little orange cloud next. That's one place where you can upload documents to your provider profiles. There are a couple different places where you can add documents, and I'll show you another one from within a provider's profile in just a few minutes. The blue star is where you can see a summary of the CME credits in your provider's profiles if you're documenting those. So if we hover, if you've documented CME credits, they'll show up here in a little chart. And then the final one is the little toggle. Green toggle just indicates that our provider is active. If I had a provider on my roster and they no longer worked with my organization, but I didn't want to fully delete their profile, I could click this toggle and it'll turn red, and then my provider will fall on the inactive provider list. And the way I would access an inactive provider list is through my reports dropdown. If I go all the way to the bottom, there's a red one. You can see it's the same icon, just in red, inactive providers. If I click there, my screen's going to do a quick refresh. And now I can see all the providers on my team who are inactive, along with the date that they were made inactive. But if I came over here, I can still access all of their data if I needed to. And I do have the option to make them active again by clicking on that red toggle. So that way, if you had a provider who left for a couple of years, then they came back, you can activate them again, and you wouldn't have to start over. You've still got all that data in place. So then to get back to the active providers, I'm going to the reports dropdown, all the way to the bottom, and active providers. It's just doing a little refresh, and I'm back at that main teams page. So the next piece that I want to cover today is actually going into a credentialing profile and kind of looking around at the different data points. So I'm just going to click on this provider's name. And my provider, this is what a provider's credentialing profile looks like. On the left-hand side, there are 13 different sections that you can add data to. And then in the center here, you're always going to see the data that's stored in each of those sections. So right now I'm on the personal info section, and that's exactly what it sounds like. It's just all your demographics for your providers. This is your email section here. So I know earlier when I added the provider, I talked to you about that placeholder email, firstname.lastname@modio.email. This is where you could come to change that once you got your provider's email. The work email section is the part that's connected to that email feature within alerts that I mentioned earlier. So this is where you would want that email that you want to communicate with your provider with. Moving down, you've got an address section, date of birth. You do have a driver's license and social security section as well. Both of those are encrypted. As you can see, once there's data in there, it looks like little stars all the way across. As a full access coordinator though, if I wanted to access, view, or change that data, I could use this little eyeball. If I click on here, it's going to prompt me, or it's supposed to prompt you for your password to OneView, and same thing with the social security number. And then you can edit or make any changes to that data there. At the very bottom, we have our CAQH information. There is a little shortcut on the date section if you're adding attestation dates or reattestation dates. And you can use T, if let's just say, for example, our reattestation date is 120 days from today. You can use T for today, and then the plus sign, and then 120, hit tab, and it'll grab that date that's 20 days from now. You could also just use T for today. It'll grab today's date. And this date shortcut works in most of the date features or date sections throughout the platform. So you can always kind of remember that as a little shortcut. If you're making changes to any of these, you do want to hit save either at the top or at the bottom before you move on to a different section, because if you don't, you could lose some of that data that you just added. So just make sure you're hitting save before you move forward. These next few sections are going to start to look a little bit familiar. They're all going to start to look the same, but education and training is where you can document all the education that your provider has had. You can see there's some existing data points already in this profile, but if I wanted to add an additional one, right-hand side, I'm going to find my green add button. There are a couple fields that are required, and the required fields are always indicated by this little red star. On all of these next few sections, you're going to see there's a lot of different points where you can add data, but there are only probably 1, 2, maybe 3 required fields. And that's because these are kind of optional for you. I know one common question we get is like, what is a complete profile? And the answer is, it's whatever your organization deems as complete. So if you need that data for your credentialing process and steps in progress, you can document it there. But if you don't need it, feel free to leave those optional fields blank. You don't have to fill them out. So if I was adding a new education type, drop down, I could hit medical school, and then I could type in my institution name. Best practice is to search by address first. So if I wanted to look for a certain school and I had the address, I could type it in, oops, and then select it from the dropdown. So this field is connected to a really large database that we have within our system of existing education places. So if I clicked here, the system would automatically fill in the address and everything for me because it's linked to this piece. If I typed in an address and I couldn't find the right spot or nothing showed up, I can also try a keyword. So I could type in Harvard and find the one that I'm looking for. But if I did come into a case where I couldn't find it, there was no match when I tried address and name, you'll see this blue pop up and it says, don't see facility name listed, email support@modihealth.com. And you can just shoot us an email here. I include the institution name, address, contact info, whatever data you need, and we'll get it built for you. Our data team will get that built for you. Moving down, practice and employer and facility affiliations, these both look pretty similar. So I click there. You're always going to have this blue toolbar, and then if you wanted to add a data point, just click the add button. From here, best practice again is to search by address. Find the correct location or hospital that you're looking for and select from the dropdown. If you don't find a match, you can email us again, support@modihealth.com. And if you want to, for these hospital locations, you can include a mailing address, a billing address, MPI, tax ID, any additional information that you want added, and our data team will get that added for you. From there, the only other required field is office type, and then you could add all these optional ones, start dates, end dates, patient age range, accepting new patients, and so on. Facility affiliations looks pretty similar. Again, you've got the green add button if you wanted to add a new data point. Facility name, best practice is to search by address. Oops. Find the correct location from there. If you didn't find it, if there was no match and you tried keywords and address, email us at support@modihealth.com. Work history. This field is for anything with a end date. As you can see here, there's an end date added. If there's no end date, if it's still current, then it should probably actually be located in this practice employer or facility affiliation section. But work history is anything with in the past. I'll click the add button. Again, practice employer, you can search by address if you wanted to. find the correct location and document it there. There's an end date section that you need to fill out. And there's also an optional reason for leaving if you wanted to. Each of these sections also has a public note and a team note. And it's similar to the one that I showed you on that team page at the beginning. But just a reminder, the team note is for your full access coordinators. Public note is for read-only, full access. And if you gave your providers access to that onboarding feature, your providers can see their own public notes. Moving down to the next section, we have peer references. Exactly what it sounds like. You can document any peer references here. I'll click add. The name is the only section that's required. From there, if you wanted to, you could add a degree. Specialty is all free text, title, contact information. And again, you've got your notes section here. Licensure. This is where you can add any licenses to your provider profiles. You can also run the little updater from this page as well if you wanted to. But if you're adding a license, you can click add. State license, you'd have to it's required to select a state. And when you're adding that license number, the key is to keep it really exact. You want it to match exactly as your provider's license is displayed. So if there are like letters at the beginning, if there's a dash and then numbers, you want it like that. And that way, further on down the road, when you're using that updater icon, it's going to be a little bit easier for the system to search that state license website. You do get a quick link here according to the state that you selected, which is kind of nice. So if you use this little plus sign, it's going to take you right to that colorado.gov website. So you don't have to keep that in a separate spreadsheet or anything like that. It's right here on the page for you. The other required field is license status. There are quite a few to select from. You can kind of scroll through and find whatever applies to your provider. Certifications. Certifications looks pretty similar to the license section. I'll click add. Board or organization name. There's a super long list here, so you can use like type in a keyword to kind of narrow it down so you're not scrolling through there. Find the correct board or organization, and then from there, you can add certification numbers, exam passed, and public note and team note. Medical malpractice. I'll click the add button again. From here, this one's all free text. You can type in your carrier or producer name, current, state, you can select, coverage, any extra details here, agent name, and then team note and public note. Healthcare payers. This is where you can track and document all of your healthcare payers here. If you want, so the first piece, again, would be the add button. From there, payer name. We've got all your major payers in here. So if you United, your keyword, you can kind of scroll through and find the right one. There's also an option to attach locations to your payers. If you click in here, you'll get a drop down of locations. The key takeaway on this location section, though, is that the locations in this drop down currently live in my provider's profile up top here. So if they don't currently live in there and they weren't added from that database, they're not going to show up in this drop down. So that's kind of the key there. Payer state, you could select, provider number, you've got your effective dates, and also your payer status. There's a lot of different statuses here. I think most folks stick to like the active, denied, in progress, inactive, and pending. Health info. Here is kind of a fun one. You can click the add button again. This is where you could track any of your tests or immunizations. So if you're tracking flu shots in the fall, you can track it there. If you're tracking COVID vaccines right now, you can track that there. And then of course you've got your team note, public note, status, completer, incomplete, and so on. Event log. In the event log here, this is a place where you can track any adverse actions. I'm going to click the add button. Event type, you can select from any of these. They're all in there, board letter, board sanction, so on. Description is just a free text. You can document anything you wanted in there. Event date, event reported, whatever the case is, carrier name, and then your free text notes here. CME credits. This is where you can add any credits. Manually, you can add them to your provider's profiles here. And then finally, we've got the document section. The document section is where you can find any of those documents that are saved in your provider profile. You can see once these start to get pretty full, you can kind of collapse them so you get a better view. On the right-hand side, there's a little number, and that's how many documents are in each section. If you had, earlier when I was showing the primary source document from the state license, if you had saved that, it would show up in this verification section of your providers. This is where you'd be able to locate those. We've got the MPI one, OIG, state license verifications, they're all right there. There's this document section down here. I know when I was on the earlier screen, I showed you the little orange cloud and I showed you there's another spot where you can add documents. This is where I like to add documents. You can see it says click here to browse. And if I click here, it's going to take me to the documents that are in the computer, my current computer that I'm working on or whatever device you're working on. So if I click here, it takes you to my documents. And I can select multiple documents at the same time. I'm going to select some Dr. Kirk-Heath documents and hit open. And because I saved these documents in a format that's a provider name, what the document is, and what that expiration date is, the system filled out the type and expiration date for me. But I do have the option, if I looked at this and I thought, oh, that type's not quite right, I can use the drop down to find whatever I wanted to change that to. And from there, I can hit upload. You can do more than 3 documents at the same time. I don't think there's actually a hard limit on how many you can do, but the larger the documents, the more documents, it tends to pause on this page. It'll take a little bit longer. So just kind of be mindful of that. And then our final one, summary. It's literally just that. It's a summary of all the data in your provider profiles, or excuse me, all the data that's in the sections of your provider profiles. You could scroll through it and take a look. But what I like about this summary is this little section over here. You have looks like a little printer. You can hit the printer if you wanted to print it. You can create a PDF of all the document or all the information here. And you also see that same Word document. You can create a CV from this page as well. So if I clicked here, I get the check boxes. I can include or not include whatever information I wanted. Hit save. And it's on my other monitor again. Sorry, just one sec. It's blocking it. It's blocking it from me bringing it back over. But normally I can pull up that CV there. All right. So that's pretty much everything that I wanted to cover from our 101 session or our new user session. I want to open up the floor to you guys if you guys have questions. I think there's a couple in the chat.
Hey there, Leah. Yeah, we do have a couple questions here. Let's see. First one, is there a way? Okay, a couple questions. Number one, how often am I going to be alerted? How often those alerts appear on an item, right? What are the intervals like? And then 2, are the alerts customizable? Is it only to those 9 items, or can I customize it to different ones?
Okay, good question. So the alerts are not customizable. It's just these 9 that our system is scanning for. And you'll get an alert once that expiration date once it's going to expire in 60 days or less. So that's when you're going to see it here at that 60-day mark. And then it's going to stay on that alerts page until, I'm just going to open this for visual, until I've run this and documented that my provider has updated their state license or their DA license. Right.
Perfect.
If that didn't answer it, feel free to ask another. Okay.
Yeah, no, perfect. Yeah, so every 60 days. So those 9 items are static. Can't change those, and it's alerted every 60 days. Perfect.
Yeah.
Another question came in that says, how do we open the OIG section? So did you want to talk about the OIG item, that integration, and also the report? Maybe I think that's the question they're asking, the OIG report.
Sure. So the OIG down here, there's the alerts. In this team that I'm in right now, there's no OIG alerts. But if you had them, they would show up here and then you could run it the same way. And then the report, I'm going to go over to the team page here. There is an OIG report here. It's about halfway down. And if I run this, I don't know why it's disappearing. It's not letting me pull it up.
Oh, the Excel. It's not.
Is it? Yeah. I'm not here. Let me run it one more time.
Oh yeah, that's weird. I see what you're saying. It's not appearing at the bottom left.
Yeah. Here, let me change a quick setting. I'm wondering if it's here. There it is. It's hiding. Okay. So here's that OIG report that I just ran. And each one of the providers on my roster here showed up. And you can use this if there's like a certain, I guess if that person is looking for, you can see the last updated date here. It runs automatically roughly the middle of the month. This one looks like it was the 15th of this month. It's usually like the closest to the 15th. That's a business day, I believe. And you can kind of see all that information here. If that's, I'm not sure if that's the right answer that you were looking for OIG.
Yeah. So this
Okay.
report's capturing. It's just so we run OIG on a monthly basis for all of your providers on your team's roster. It's ran sometime in the middle of the month. That's where you're going to be able to find that report to see if anything pulled up on those providers. So that's why in our training teams alerts section, you don't see anything in OIG because it's already been ran for the month, right? And again, it's ran sometime in the middle of the month. So hopefully that answered your question. Perfect. Awesome. Thanks, Leah. Appreciate you. Leah Green, one of our coordinators.
Thanks, Brandon.
Yeah.
What other?
Sorry, I'm looking here. Okay, so another question came in. The question was asked, how, let's see. So this question came in, it has to do with deleting providers from your team's roster and inactivating them, right? So Leah covered, well, yeah, did you want to talk about that, Leah? How they can only inactivate providers, they cannot delete it, and then maybe the process of how they can delete a provider profile?
So to make it inactive, so if you wanted to remove it just from your team roster, but not delete all that data, you just click this little green toggle and it'll fall into the inactive status. And from there, you could find your inactive providers over here. You've still got all that data if you needed it. If your provider came back to work for your organization again, you can pull them back over just by clicking this toggle here. It'll turn it green. They'll come back to your list. If you needed to do a hard delete though, that has to be done through our support team. So you would email that support@modihealth.com and then they could take that care of that deletion for you on their end.
Perfect. Yeah, and just also to underscore, so so Deborah, this is for your question that you had. A coordinator within our system is somebody who is logging into the platform and working on it, right? That's not considered an admin, so you would be considered a coordinator. And like we mentioned, if you want to activate a provider you inactivated, just simply go to the inactive roster and then click on the red toggle and it'll put them back in active status. Hopefully that answered your question, Deborah. If not, we could I can reach out to you after this call and we can kind of connect and see. But
Right.
let's see. Let me see if there's any other questions. Oh, in a provider's profile, Leah, there's got the different sections where what are the check marks mean in those boxes?
So the check marks, that's a really good question. I feel like the check marks are a little bit confusing. The check marks indicate that everything that OneView requires is filled in. It's not really something, the little check is not something that you guys can control, but there is a way that you can kind of make it your own. And you can right click on any of these sections. I'm just going to right click and then hit verify. And it does turn it that white color. And you guys as coordinators will be able to see each other's checkboxes as well. And I know what a lot of organizations use this for is maybe you're going through as a team and you're kind of running audits on your profiles and you're saying, oh, I checked the practice and employer section. I know it's complete. I'm going to right click and verify it. Or you could say like, I made sure there's 3 peer references. I'm just going to click it and indicate that it's verified so that the other folks on my team know. So you can kind of use those that way. You can also right click if you checked something by accident. You can unverify it by right clicking as well.
Perfect. Thank you, Leah. Appreciate it.
What other questions?
You've got another one here. I'm reading it real quick. Question is, all inactive providers will be shown while we are adding a new provider? I'm not quite sure what that question means. I think she's asking. So again, you have two different rosters you can look at within your team. You have active and inactive. If you're adding an existing provider via the add provider function, and they're already on your roster where they're maybe inactive, it will not allow you to add that like as a duplicate, I believe, as long as it's using the same email address. Hopefully that answers your question, Danny. I think I got it right. Let me know if not.
All right, any other questions? Anything anyone wants to see again or go into more detail on?
No, I don't see there's any other questions here. This one came in. Can you copy the list of payers to a new provider from an existing provider versus adding them individually?
Yes, that's a really good question. I'll do a quick example. I'm just going to go into one of our pretend providers here from our training environment. If you go down to the payers section, there's already a few existing payers, but there is this copy button here. So if I click that copy button, there's a couple different ways you can do it. I like or I think what your question was directly about it from another provider's profile. So you'd want to click another provider. And then from there, you get a drop down of all the providers on your roster, as well as any FACs if you have them. And then from there, you could select. So if I wanted all of the payers from this Dr. Jennifer's profile, I can click her name. And now down here, I see all those payers listed. I can customize it. So if there's like just one or two that I don't want, I can X out of them and not bring those ones over. And once I have it set just right, down here on payer fields, I can choose, or usually you can choose payer contact. If any of them had the contacts listed, you could do that. And facilities. Payer status. If I knew that they all had that same status, I could select all of them as active so that that comes over as well. I also have the option here to include PAR status when I'm copying. So either if they're all PAR or they're all non-PAR, I can do that. And then if I hit save here, all of a sudden, all of those payers are added. So if you have one profile that's really complete, has lots and lots of payers, you can always use that profile. You just click that copy button and you can bring it over rather than typing everything individually. Save you a lot of time.
Awesome. Thanks, Leah.
Yep.
There are no questions now. Anybody else want to have any other questions you'd like us to address before we end the call? We'll leave it open for another minute or so.
If there's no other questions, or we'll wait for a minute if anyone's still typing. But if you're like a newer user, just remember that support tab is always there for you. Lots of good tip guides, lots of new ones I think come in that you can see there's new ones added all the time. Lots of good resources here. And of course, we've always got that support@modiohealth.com email address if you ever need to reach out. But if there's any other questions. I'm seeing the raise hand.
Yeah, I'm reading the question.
Is that? Oh, you are? Oh, sorry. Okay.
Dina, I think you're referring to the onboarding feature. This question came up a couple times during the call. So there is an onboarding feature within the system that's kind of not on topic today, where you can send out an onboarding app, like an electronic application to your providers, which you can make fields mandatory for that provider. And if you want to learn more about those, Leah, if you can take them to the Modio U page and show them the pre-recorded training we have, they can go back and watch that to get more details on that.
Yeah, there's a lot of, if you wanted to watch this onboarding invitation, course 103. It's a pre-recorded, I think it's 40, 45 minutes or so, but it'll really, really deep dive into this onboarding feature. In addition to that, training support, we do have an onboarding tip guide here with like screenshots. If we scroll through it, I know we don't have enough time to cover onboarding today just because it's such a big feature. There's screenshots of what your provider sees. The second half of that tip guide is your as a coordinator, how you access it. It's really like step by step to get you through, and how you make certain data required, how you make it read only, and so on. You can access it all there.
Awesome. Thanks, Leah. Hopefully that answered your question, Deanna. Let's see. What? Oh, that's a good one, Deanna. Leah, what does prepend mean on a note?
But I'm not sure where.
So open up pick on one of the profiles. Yeah, so right there. See where it says prepend Leah? Yeah. Do you want to talk about that?
All right, Brandon, do you want to take that one?
Yeah, sure thing. Yeah. So when you check prepend, like go ahead and add a note, Leah, with it checked. Just go ahead and put test or whatever. It's gonna say, now go back. It's gonna say like, Leah's name right there. So Leah added that note. If you uncheck that box, it's like uncheck it and then add another note. It will remove Leah's name from whatever note she just added. That's what prepend means. So prepended by Leah Sanborn. So just add your name to the note.
Oh yeah, there it is. Thanks, Brandon.
Yep. So yeah, great question. I think that was it. There's no other questions here. Yeah, I guess you can go ahead and close it out, Leah.
All right. Thank you all for joining. Let us know, of course, open up if you need anything, support at modiohealth.com. And remember, the support tab here and ModioU tab are always there for you. All right. We'll see you all next time.
Thanks, guys. Take care.